Welcome back to the D&N Medical Series. This is your girl Nikki, and this is
Damar.
good. And today we have a very special guest with us. Today we have Dr. Mikhail Benjamin, and he's a new doc on the block. He's our fifth-year representative, and he's here to share his experience with us. So we're just going to start by asking him, Dr. Benjamin, can you tell us about yourself? Who is Dr. Benjamin?
All right, so hi again. Just to reintroduce myself, I am Dr. Mikhail Benjamin. It feels very, very strange saying that even now, even though I've been a doctor for a month now. So I'm an intern at the Mandeville Regional Hospital, currently doing 3 months of surgery. I'm currently on female surgery ward, so we do 6 weeks at female surgery and 6 weeks at male surgery. And what about myself? I love to exercise, I love sleeping, and I love the color red.
That's very good, very precise and nice. So before we jump into your medical career, we just want to hear a little bit about your background. So which high school did you go to?
All right, so I went to St. George's College from 2008 to 2013. No, yeah, 2008 to 2013, and then I did sixth form from 2013 to 15. So from 2008 to 15.
Oh, nice. Big up St. George's.
Yeah, man. Back in my time, it was really underrepresented in medicine, but I'm glad to see that the numbers, take time increase, and yeah, I love that, and I'm motivating the young men at the school. If anybody at George's wants to know anything or any high school in general, they can message me and I'll talk to them about it. I'll tell them how to get in. I'll tell them all the information that I know.
Nice. Now, I love to see it. We love to see it.
Thanks.
Okay, so from St. George's, and you said that you're doing your internship in Mandeville. So why Mandeville?
All right, so 2 reasons. So I live very, 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 very close to Spanish Town Hospital. I'm from Spanish Town. I'm a Spanish Town native. I live like a 3-minute drive away from Spanish Town Hospital, and I did not want to be home for internship. I wanted to branch out and experience being an adult because I've never really, had an experience outside of being home. Because I've been traveling from Spanish Town to Kingston from I was 11 years old right up until I know when I'm 23. So I really wanted that different experience, being somewhere outside of being home and having adult responsibilities. Like now, for the first time in my life, I live on my own. I'm actually paying light, first time ever. I have bills. All of these things are just new, completely new. Yeah, and the second reason was I did most of my rotations in Mandeville in final year. Actually, I did 6 rotations in Mandeville. I did obstetrics, ophthalmology, orthopedics, medicine, surgery, and pediatrics. So I did 6 of my rotations in Mandeville, which is hard to get, but you have to have those Twitter fingers when you're doing site selection, and I have them. So I really like the experience of being a student at Mandeville, and I remember when I did my surgery rotation at Mandeville earlier this year, and it was extremely good, and I was like, yeah man, this is definitely where I want to be.
Okay, all right, that's right. All right, well, I'm happy you're at the place that you wanted to go, right? I'm happy for that. But let's just go back to before med school. So growing up as a child, was being a doctor something that you always wanted to do, or there was something else that you had in mind before medicine?
To be completely honest, no. I didn't. Being a doctor was nowhere near my. I could not even. First things first, I didn't like doctors when I was a child because when I was 4 years old, I actually was sliding. I was visiting my grand aunt, and on her veranda it was tiled, and I had on socks, and I was running around on the veranda, skating around, and I slipped, and I hit the back of my head, and I got a laceration there, and I had to get 4 stitches at Linstead Hospital. Big up Lindsay Hospital. Hospital was a recipient for my smoker in 2017, so that's good. And I got 4 stitches in the back of my head, and it traumatized me. So being a doctor was nowhere near my radar. I actually wanted to be a cartoonist. I like animation. I like drawing. I like all those creative things. And I used to like singing and songwriting back when I could sing. But puberty came and had different plans. And
What you mean by when you could sing? By the end of this, you have to drop us a piece, Oh.
Like when I was a child, I had a singing voice, but puberty came and just swept it away. So I feel like I would be in some creative field if I was in medicine, something having to do with animation or drawing or anything like that. And in my spare time, I have Lightroom Pro, Photoshop. Yeah, Lightroom Pro, Photoshop, and some other animating softwares on my laptop. So in my spare time, I animate.
So question, you're the catfish doing all this Photoshop and thing? Are you a catfish?
No, I've never photoshopped any of my pictures, but I have photoshopped some of my friends' pictures for them.
Sure, we believe you. So we're jumping into medical school now. So we want to hear which courses or rotation did you love and hate the most, and why?
Okay, so I really enjoyed pathology and microbiology that you do in 4th year. With pathology, so I've wanted to be a pathologist for a while now, since probably when I was like 17 or 18. This sounds weird. Most people find it disgusting, but actually I like autopsies. I find autopsies very interesting. And when the pathology rotation, you go to a few autopsies, and most persons stand behind the screen. Nobody wants to do the autopsies. But I was one of those students who, carried my scrubs to school and was like, look, I want to participate in this autopsy. So I participated in like 6 autopsies, and I found it extremely interesting. I still find it interesting. So I really like pathology. And I like ophthalmology too. Ophthalmology is just really chill, really cool. It's not a bad rotation at all. In terms of rotations that I absolutely hated, I hated orthopedics. I hated it so much. And I feel like it's because I had a mind block against musculoskeletal in the first semester, and orthopedics is basically musculoskeletal 2.0. So it just did not agree with me.
Wow. I think we're so similar in that regard with that aspect. I think that pathology would be something that I would be interested to. But as I said, the musculoskeletal anatomy is not really me. So I don't enjoy that. I think that is Nikki's area.
Yes, of course.
Well, they say orthopedics is the highest paying specialty in Nikki, so go in there.
What are you saying? Is this music to my ears?
Okay. All right. I know that you said that those were your favorite rotation. All right, but entering into clinicals, did you have any expectation as to what you thought you would have liked, and did it match up to your expectations in terms of the different rotations?
All right, so I thought I was going to like psychiatry a lot more than I actually did. Psych, the ward rounds and psych are nice because you have sit-down ward rounds where all of the consultants are in one room, all of the residents, all of the students, and in medicine, when you do ward rounds, you stand up. So when you have sitting ward rounds, that's very nice. So you sit down and you discuss the patients without the patients actually being there. So I found that very interesting in psych. In terms of dermatology was a really nice rotation too. The patient load was so low on dermatology, and there aren't a lot of topics tested in dermatology. I think dermatology was a nice rotation. What rotation did not match up to my expectation? I'm trying to think. Maybe medicine. Yeah, definitely medicine. Or if I'm being honest, a lot of rotations, because I don't know why I had this whole different idea of what the medical system in Jamaica would be like compared to what it actually is. Like we are, I've, I'm not trying to, diss it or anything, but we're very resource limited, very, very resource limited.
We're
I
dissing
tell,
it.
hmm I tell my mother all the time. I spend half of my day searching for the resources to do the work. So I spend half of the day searching for the things and half of the day actually doing the work. I've been on the ward before and there aren't any gloves. I've been on the wards and I finished ward runs and it's time to take off bloods. There are no red top tubes. And red top tubes, like everybody want a U&E and no red top tubes. And me, I feel walk to other wards and be like, you guys have any spare red top tubes? You guys have any spare this, any spare that? That's ridiculous. That's
But come
ridiculous.
to
Mhm.
your point on that, you're talking about resources, medications are included in that, right?
Yes,
Well,
most
I
definitely.
just heard your Minister of Health
Hmm.
says he failed to believe that there's any shortage of medications or resources for you guys. So why are you lying? What the African something you said? Why are you lying?
Like, trust me, being underground, like everything is limited. Blood, I cannot even begin to talk about blood. My goodness, man. Some patients on the ward with their hemoglobin less than 3 can't get a bag of blood. Can't get a bag of blood. Like, and
So,
mhm.
so just to raise a point, guys, they're in need of blood. If you can donate blood, this is a good time for you to
Right,
just sign
right.
up. Like, try
Mhm.
to donate blood. There are people out there who are in need, right?
I
So just
mhm.
walk in and try to donate some.
We should
I would
definitely,
definitely.
yeah, we should definitely do a partnered blood drive. Like, try to gather people to go to blood drive and give blood that day. That's a very good idea. Come to
Mhm.
think of it, because yes, don't just give blood when you hear say you have a family in an accident and you recruit.
Mhm.
It's normal to go and just give. Because a lot of you could save so many different
You
lives.
really could. You
And it's
really
not
could.
painful. And some of the times when you're finished, you get a Malta.
Mm.
So it's good. Please go and give some blood today, guys. Their lives depend on it.
All right.
So, oh
All
yes,
right.
my
So,
next. Go ahead, Damar.
oh, you were gonna ask something?
Oh, okay, I'll ask. So, what's the hardest and most rewarding thing about your job?
All right, so the most rewarding thing about my job is actually seeing the patients improve and seeing the patients be discharged. When I started in July, I had this patient with diabetes and stuff, and she had some complications from the diabetes without disclosing any patient information. And like she left the other day, she spent about 3 weeks in the hospital. I'm here to tell you, sir, to see that lady's blood sugar normalize, man, me feel proud because me know say, yo, and me bring that down. Because it's just so sad. It's honestly rewarding. When you see the patient go home and say, all right, they're going home to their children. Them children never have their mother for 3 weeks and now they're being reunited with their mother in a good state of health. It really, it genuinely warms my heart. That was the main reason why I decided to go into medicine. I like helping people in a, how would I say, not just a normal way, but
Health
me not even know,
wise, health
yeah,
wise.
yeah, health wise. Hmm.
Right, right, nice. I love that. What about the hardest?
All right, so the hardest part I would say is that the long working hours and the long standing. The working hours are long. A weekend duty is 24 hours. A holiday duty is 24 hours. A weekday duty is 16 hours. And the thing is, when you say 16 hours, it doesn't sound that bad. But when you consider that a weekday duty starts at 4 in the afternoon and ends 8 in the morning, right? And your normal workday is 8 to 4. So really, that's one entire workday from 8 to 4, and then the duty from 4 to 8, and then you have a next workday right after going from 8 to 4. And so that's 32 hours basically. And you don't always get to sleep.
So we don't
And
deserve sleep and so we don't deserve them someday. You know, look
like
so.
trust me, you have your
Work.
teeth for sleep sometimes. Sometimes
Yeah.
like you have to cross your finger and pray to God say the IV access. Nobody no call you in the night about a IV access because boy, them that's some of the worst one. Them you sleep and somebody call you, a nurse will call you and say, "Oh, IV access is out," and you sleep a bite and you have to just brush your teeth and wash your face and come out of your bed and decide the access and stuff. It's hard and the long standing. I'm 23 and I feel myself having pain in my legs, like mega develop venous insufficiency. So I'm considering getting compression stockings right now.
Right, and would you look at that? And you said you love to exercise, so you're physically fit and you're still
Mm.
experiencing this. What about me, who doesn't do anything? My legs will be doing this.
Well, you better start from now. You better start from now. Train them legs.
Oh my God.
All
So
right.
yes.
So
Mhm.
my thing would be so I guess clinical year starts at year 3 and it
Mhm.
goes all the way to final year in year 5. So I want to know how was final year for you compared to the other clinical years, and how is it different now being an intern since the past month?
All right, so I think final year, to be honest, in terms of like the content that you learn in final year, I think final year is just one big revision year because in final year you do senior medicine, senior surgery, senior child health, and you do community health, and then you have elective for 5 weeks. You've already done all of those courses before, and you're not really learning anything new, really. So I think it's really just one big revision. You might go more in depth now, but you're really relearning everything. The problem that I had in final year is that I started experiencing burnout around the end of first year. And a lot of people don't really think about it, but to be home and to be constantly studying, and when you get to clinicals, you feel like you're at work. So it's like you have a 9 to 5 and then you have to go home in the evenings and study. You don't get a lot of sleep and it gets exhausting. It gets genuinely exhausting. You're studying for 5 years almost every single day. It gets repetitive. It gets exhausting. It gets tiring. And then right in final year, I had 5 weeks left in final year when COVID came to Jamaica. That was a whole disaster right there because they shut down school. They told us that all right, school is going to start back in April. Nobody had any idea what was going on. We didn't know how the classes would be formatted. We did. We were being told that MBBS could have possibly been in October. Imagine being 5 weeks away from your final exam and somebody come to you, oh, October. It was depressing, and being somebody who exercises as a way of relieving stress. The gyms were shut, so I wasn't able to exercise. I'm a big extrovert, so I like being around my friends. I like seeing my friends. I was no longer seeing my friends on a daily basis. My mother works in a grocery store, so she was gone every day because that's essential work in COVID time. So I was at home isolated for months, just studying. It was bad for my mental health, and I'm glad that final MBBS is over now and I passed and I can be around people again, and I can be exercising now because the gym's reopened.
Ooh. Nice, nice. Excellent, excellent. I'm happy that you're more happy now and you're happier now. And I want to ask you about your strategy through med school. What strategies did you use through pre-clinicals, clinicals, and for final MBBS?
Okay, so for preclinical, so I live far. I live in Spanish Town, so to travel from you to Spanish Town every day, it's a lot. So what I usually do when I get home in the night, and I've been doing this since high school, I go to my bed when I get home, and I wake up back and I study. And boy, thank God for my mother because she wakes me up to study like consistently. She's been doing it for years now. So most mornings, like 1, 2 o'clock, 3 o'clock, if you message me, I'm going to reply because I'm usually up studying. And I find that's kind of helping now with internship because if somebody wakes me up in the early morning, I can actually stay up and do the job. Because some of my friends tell me so, sometimes the nurses call them and them just fall right back asleep. In terms of clinicals, when you're doing clinicals, I would recommend go in and actually practice in your examinations on patients, because a lot of the examinations are a lot of different steps. Like with the cardio examination, if I remember right, they said the mark sheet is 36, and you have to score like, if I remember right, they said 27 or close to 27 for you to be considered a pass. So when you're doing the examinations, I would say go like read the examinations, watch a video, go to the hospital, find a patient with a pathology, not a normal patient, find some patient with some finding, and make your friend them watch you. Make them time you, start the timer, and don't put it for 5 minutes. Put it for 4 minutes and 30 seconds. Start the timer. You examine the patients, print the mark sheets because the mark sheets are available. Print the mark sheets and have your friends grade you. And afterwards, present your findings, and then your friends can critique you. I would completely recommend that. It sounds stressful enough, but when I say, when you get the exposure, when you get into the actual exam, it's not going to be nothing new. It's not going to be anything new. You've done that before. You've been under that pressure before. And the best person to hear it from are your friend them. It better your friend them critique you. When you're in an exam and a consultant to tell you, say, oh, you never do this, and it feels completely different now when you're being critiqued by your friends. And next thing that I would recommend for final year specifically, I would say work past papers, and not work past papers. When I say work past papers, I don't mean work them with the intention that, oh, I'm going to come back and I'm going to see this question and come back. Because really, if I that you look out for final Mbbs, it's not organized. But the thing is the repeat concepts. So if you do a good amount of past papers, you know the topics that they like to come with. So you can know, so, all right, I need to know this topic. I need to know that topic. And sometimes they do re-ask questions, but them turn it a different way. Them turn it a different way. So it's the same question, but worded differently, or the answer may be different, but it's the same concepts that they test. So I have a study group. I had a study group. We still have the group chat, and we started doing papers from around November final year. So we do religiously. We meet on Wednesdays, Fridays, Wednesday nights, Friday nights, and sometimes Saturdays and Sunday, depending on how many papers we have to do. We divide the questions. We have this big Google document. So we have a big Google Doc with all of the past papers. We have this big every day every time we meet we have a Google Doc. So everybody type up them questions, type up them answers beforehand. And then when we meet, we actually discuss the questions. Like, so it's not just like, all right, question 2, answer E. No, question 2, answer is E. This is right, why the other choices are wrong. This is why the other choices are right. So when it came around to final Mbbs time now, and there are a lot of persons just doing past papers, me never have them struggle there. I was studying and I was looking back over and I was like, oh yeah, I remember when we did this paper. I remember this, I remember that. And when you work the past papers right through a final year, it keeps you fresh. Like, for instance, I did obstetrics and gynecology first, and I was doing obstetrics and gynecology papers every Wednesday. So it keep you fresh. So you could be studying medicine, you still have to go, when you get your question, you still have to go read back over obstetrics and gynecology. So I find that it kept me sharp through a final year.
Nice, beautiful. So Dr. Benjamin just summed up his experience with us, or his 5th year experience, his experience with the Mbbs program as well as the final exam, and what's it like being a little intern right now. So we thank him so much for coming, and we just want to finish off by playing a little game with him, and for him to just tell us what was it like. So we'll see a different side. No, so we want to hear all the good stuff. So let's wait for the bad. So it's never have I ever. So I'm going to ask a question, and if you have, you say I have, tell us why. Mm-hmm. If you haven't, say I've never have, and you tell us why. Mm-hmm. All right. So we're going to start with never have I ever fallen asleep in class.
I haven't. I've been close to falling asleep in a class, but I've actually never fallen asleep in a class. But I've been very close to, because some lecturers just boring, very boring.
So you mean to tell me that over a 5-year period you have never slept? No,
Mm-mm.
sir.
Not not in the class. I have missed class before to sleep, but I've never slept in a class.
That's even worse.
Yeah.
You just confessed that you missed class to sleep. That's
What?
worse than falling asleep in class.
You see, when we were
Okay.
doing mhm.
Mm-hmm.
When we were doing UG, like God bless if me go 5 lectures out of UG. I read that whole course by myself. I couldn't be bothered.
After you just give much advice and then you behave. Okay, we'll jump to the other one. Never have I ever wanted to quit medical school.
Oh gosh. Yes, 100%. I remember so many times throughout medical school, so many times, from so many times I wanted to
That's a
quit.
lot
And
of times.
yeah, I remember at the end of fourth year, I did emergency medicine last, and I remember I started fifth year like 2 weeks afterwards, because you know the breaks in between medical school are like one in fourth, and between fourth year and fifth year, and between third and fourth year is like 1 or 2 weeks. That's ridiculous. You know, you're still tired when final year starts. So I remember I was saying to my mom, I'm really sorry I didn't take a year off after fourth year, because I'm just really tired. And my mom was like, no, you can do it. Just think of it as one last hurdle. You can do this. You can do this. And trust me, I can't stress how important it is to have a good support system in medical
You know
school,
what I
because
want to
you're
do? I want you
mhm.
to just big up your mother right here. So,
Yeah, man. I want big up my mom, Miss Eula Lee Tough, man. She's been, I can't even describe how monumental she's been in my life. I remember the night when I got the results of final in Mbbs, me run go in her room and me I scream, and she never even shocked. She was like, "Oh, I was expecting this." No shock, even though she not shocked, no tears, no nothing. She fully believes in me. She believes in me way more than I believe in myself, and I feel like you need positive energy around you, especially in final year. You don't need no negative energy. If you have people around you who aren't helping you out, who aren't, pouring into you and you pouring into them, just you don't need that.
that is true. I'm so happy for you and your mom because not many persons have a strong support system, and especially with being a male, the average person thinks that, oh, what this boy, and to see her grow you and mold you and make you into something and believe in you like you didn't even believe in yourself is absolutely inspirational. Big up, mommy. Big up, big up, big up, mommy. So we're gonna end with this last never have I ever is never have I ever skipped a word round.
Oh, 100%. I've definitely skipped
No,
a word.
I'll be 100% instantly.
I've definitely skipped word rounds. Yo, I remember when I was down at KPH on surgery. I remember I skipped like 3 whole days, and because the exams were coming up, I skipped 3 whole days. And when I came back on the ward, we come back because we did warm evaluation. And the consultant was mad. The consultant was like, where have you been all this week? Because I came on Monday, and I came back for the evaluation on Friday. Tuesday, Wednesday, Thursday, nowhere to be seen. Me there home, lock up, studying, don't have no time for the social media lock off. Yeah, I've definitely skipped word rounds. 100%.
Oh
Guys, you can
my god.
I'm not encouraging the behavior, but you have to do what you have to do, because it better you pass your exams and gone through, because trust me, nobody wants to be repeating exams. Not saying that there's anything wrong with repeating exams, but
Right.
there's, yeah, if you don't have to do it, don't do it, because in medical school it can be really stressful, especially with how the courses are configured, where you don't get like breaks in between courses, and you don't get breaks in between the years that are actually substantial breaks. You find that if somebody is repeating a course, they have to be studying for 2 exams at the same time. You don't need that.
No work. No go work, sir. So we want to end with one final question, and it's why do you like the D&N Medical series?
All right, so I like the D&N Medical series because it's like you guys give us a view in what it's like being a medical student, and you give us. I like the quizzes a lot on Instagram, and I don't know if you remember, but I remember the night before my obstetrics final Mbbs exam, I was answering some questions that you guys had, and remember me messaging after the exam the day because two of the
I
questions
remember,
actually
yes, and you
came
were
back.
saying, this was in
Yeah.
my
Yeah, like it literally when I answered the quiz, I'm messaging and I'm like, I just finished the exam and two of the questions just come back in the actual exam. Yeah, I think it's a very good series and I think it's very motivational seeing that you guys can juggle this and still be doing medical school. Because people make it seem as if oh medical school is the end of the world. No, you can still find time to do things that you know are of value and importance to you.
Right, guys, did you hear that? The night he was, we had a quiz, and I put up the quiz, and he got it in his final MBBS for him to graduate from medical school, and then he messaged me and said, "This came back," and I was like,
Yeah.
"Really? Yes!" And I was like, I know you get it right. I know you get it right
Yeah.
because you had it in the quiz and everything." But yes, guys, it's a really good platform. You guys should definitely think about subscribing if you haven't done so
10 out of
yet.
10 recommend.
Exactly. Look at that. So we want to thank Mikhail. I mean, not Mikhail. We want to thank Dr. Benjamin for coming and sharing with us today. We thank him so much for telling us about his experience and taking his time out on today. We recorded this video on Independence Day. Would you look at that? Happy Independence, Jamaica.
Happy
And
Independence Day.
right. So we want to thank him so much and we want to continue for him. We want him to continue to keep up the good work in everything. So when you go down to Mandeville Regional Hospital and you see Dr. Benjamin, they say, "Hi, I saw you on the D&Nmedicalseries. Hi." He's not going to let you skip a line, but he will treat you nice and, yeah.
Mm-hmm.
So thank you so much, Dr. Benjamin. And we want to also big up mommy, big up Dr. Benjamin, mommy at all times. And yeah, don't forget to like, comment, share, and subscribe to our
And
YouTube channel.
subscribe.
Right. Until next time, see you soon. Bye.
Bye.